Hi, my name is William Fox.
Hi, my name is Travis Waters.
Hi, my name is Cameron Hinkle.
Hi, I'm Emily Oliva, and I'm going to be starting off the presentation. And our presentation is about myocardial infarctions, commonly known as heart attacks. So heart attacks are medically known as myocardial infarctions and are one of the most common causes of death in the United States. And they are caused by the blockage of blood flow to the heart muscle and is a medical emergency that requires immediate attention. So common risk factors have two categories: factors that can be avoided and factors that cannot be avoided. And factors that can be avoided are age and the family history of an individual, such as like it's an inherited condition with higher, if someone in your family has had some type of heart disease, you have a higher chance of developing one too. So factors that can be avoided is are smoking, poor lifestyle, and unhealthy eating. So it is important to lead a healthy lifestyle and have healthy eating choices, and not to have loads of stress piled on top of you, or not to stress yourself too much over situations, because this can lead to an unhealthy heart rate and hypertension, also known as high blood pressure. And another risk factor that can be mentioned is that men are more prone than women under the age of 65, but the prevalence is higher for both men and women in older ages. So as you age more, you have a higher risk of developing a heart attack. So now Will tell you more about the numbers.
In the United States alone, over 500,000 myocardial infarctions will occur annually, and of the majority of these myocardial infarctions, they will be experienced by individuals not previously disclosed to heart disease, and even then, over 25% of those who will experience myocardial infarction have had previous experiences before. Geographically, if we look at the chart describing heart disease death rates in the United States provided by the CDC, we can see a very clear cluster of occurrences relatively local to the southernmost point of the United States. The occurrence rates in the United States is still very high, and by transitioning to the line graph shown on the presentation, by observing it, we can see a drastic drop of mortality rates in the United States between 2000 and 2005. Yet, if we look closer, we can see that past the year 2005, the trend started to increase again, and it is still increasing to this day. Advances in medicine and enhanced treatment of care for patients is progressing, but in order to get those numbers down, we have to do more with public health interventions. And for that, Cameron will speak more about it now.
Hi, so some public health organizations, such as the American Heart Association and the Center for Disease Control, have been working on an action plan to broaden information for the public on the topic of myocardial infarctions and better plan on informing everyone involved. This action guide is for individuals seeking change in the political and health aspects in their lives. The action plan consists of 5 major steps. The first one being nutrition, which states that adults should avoid processed meat and sweetened drinks and should eat more plant-based foods and lower fat meats. Exercising is the next important step and says adults should get up to 4 hours of a mixture of moderately intense and vigorous activities. When visiting your doctor, you should discuss any use of tobacco in the last month and also discuss any plans for quitting. Some social determinants should be discussed with your doctor as well, such as housing, food security, transportation, self-image, and culture. The final step in the action plan is regarding aspirin, which shouldn't be taken for prevention unless specifically prescribed by your doctor. Moving on to Travis. Yes.
Thank you, Cameron. So talking about disease agents, are there disease agents in myocardial infarctions? So when characterizing a disease, scientists look at the disease agent, which is a causative factor that must be present for a disease to occur in a susceptible host. So when analyzing myocardial infarctions, the disease agent is not applicable as it is not a transmittable disease. Oftentimes, the predeterminant factors are genetics. Studies indicate that although African Americans make up a significantly less percentage of the population than whites, they account for more deaths by myocardial infarctions than any other racial group. What is also surprising about this is that the disease affects more men than women. Pardon me, males often exhibit symptoms of chest pain and shortness of breath, while women have pains in their back and often vomit. There are many ways to treat myocardial infarctions, two of which are being an angioplasty and a surgical heart valve replacement. Angioplasty is simply a balloon-like tube that is implanted into the artery that expands the artery to allow blood flow to happen. And so today we have went over what a myocardial infarction was. And so thank you so much for watching.